Thanks. So if this can be lifted up and then you can use the fillers to sort of coat the particular area, you can give these sort of results. And there are certain scar marks that you see on the patient that is after the carbon dioxide laser has been done on her as well. So it's combination therapy. Now you also can see these, this is my more of our wonderful patients who has a very squarish sort of a face. And you can see that that face, in my opinion, makes her look slightly aggressive because the face is very angular. And using the Juvederm Voluma laterally, using the Juvederm Ultra Plus medially, using some threads to raise her face, you can sort of change the face itself so that there is a certain amount of lift which has been caused in the zygomatic and the maxillary areas, changing the entire way she ends up looking. Not everything will be possible non-surgically, and therefore surgery comes in. And the mid-face lift, which is our method of using, causing the face lift, is very important. And we use the intraoral route for this. So basically what we do is we go from the superior gingival sulcus, and by going through the superior gingival sulcus, we sort of raise the malar fat pad. And by raising the malar fat pad and taking 2,0-proline sutures through the fat pad, then tunneling the sutures up over the zygomatic arch and coming up behind the hairline. And since one incision is inside the mouth and one is behind the hairline, you can now tie this to the deep temporal fascia. The moment you do that, you are sort of hiding all the incisions and yet causing a face lift, which can be seen in how the left area appears much better than the right malar area. And that's how the entire thing works. So if you give traction, you can actually see the traction being conducted, and you will get, boom, in 45 minutes, a good facelift, which typically ends up lasting for about at least 5 to 7 years. Carbon dioxide laser is important for whatever we do, and carbon dioxide laser plays a very important role to sort of also treat the face appropriately, especially post-surgery and in facial rejuvenation and also in acne scars. This patient of ours underwent a mid-face lift, upper face blepharoplasty, lower blepharoplasty, and carbon dioxide laser. And that's the same sort of another patient who's undergone a mid-face lift, blepharoplasty, carbon dioxide laser, etc. These sort of changes are transformative. I think we should stop looking at people as 60-year-olds and say you deserve to look like this, because the fact is we will also be 60 at some point, and I'm sure our souls will still be young. There's no reason why our faces can't also be young at that point. Another thing that we do very regularly is to do facial liposuction. So you do a facial liposuction in the part which is extra fat, like the double chin area or the jowl area. Take the fat from a Lurelock syringe and sort of transport it to the upper part of your face, which is the which can then be used to transform the face. So you can see how the shape of the face can end up changing in these people. Now, this lady came into us and she wanted to know whether we can transform her face and whether we can give her dignity. Dignity is a very important part in all human interactions. She's 47. She had, at that moment in time, just gotten out of a messy relationship. And she wanted to know if we could make her feel happy when she looked into the mirror. And you can create these changes, you know, literally using non-surgical techniques. In her, the Ulthera was done, the Botox was done, the fillers was done, and she was transformed completely. As we move forwards, as we continue publishing papers and trying to push science forwards, we can also see how certain things can be changed. So earlier, whenever you had a squarish jawline, you had to either do orthognathic surgery or do a masseter stripping surgery, both of which led to a significant amount of morbidity. But what we have seen is that you can actually use botulinum toxin. And botulinum toxin is an off-label use for masseter hypertrophy. But what our group did is we actually documented where it should be injected, how much should be injected, how many sessions should be done in order to transform the face completely. Look at these differences. So look at how the shape of the face is changing over a period of time. And you can imagine as the shape face changes, how much transformation can occur in the mind of a person. And you can see that if you've done this if you've done 4 sessions of these, the results are there even 4 years later. So in that sense, it almost becomes like a semi-permanent sort of a treatment. And why would you do orthognathic surgery when you're able to make the changes just with simple botulinum toxin injections, which is predictable, causes less morbidity, and can actually transform faces. We also do a lot of non-surgical rhinoplasty. And initially, when I started rhinoplasty 15 years ago, At that moment in time, non-surgical rhinoplasty did not even exist. In fact, in 2018, when I got invited to Brazil for the World Congress in Aesthetics, at that moment in time, we didn't have any slides on rhinoplasty. But what I'm trying to document and show you is as the products become better and better, and our techniques in using them become better, these are the sort of results you can create. So this is how non-surgical rhinoplasty is done. You're putting a cannula in, you're going pre-smash in the nose, and you're sort of going supraperiosteal, and you're putting the fillers in. And you can also do it from the other side as well. Yes, it's not the same surgery, but you can create some results, as you can see in some of these patients. And more importantly, you're able to even structurally change the nose such that the orientation of the nostrils, etc., start changing. You can also use threads for the nose. And threads, once they are used, these are some of the threads which are being inserted. And as you put the threads in, you can see how transformational some of these procedures can be. This is being done with prilocaine jelly being used. And then once you have used that, you can actually transform the nose with the fillers and the threads. That's one of our patients. And you can see how the nasal bridge now looks far better. And you can see how it has been filled up with the filler and with the threads pulling up. And you can see how the nostrils are far more angulated. And you can also use these particular techniques to hide dorsal nasal humps. And not even that, when people smile, you can actually see how the entire shape of the nose has been changed by just using fillers and threads. And so the question is, when we offer our patients these sort of techniques, then clearly they turn around and tell us that they don't want to undergo surgery. Who would want to undergo surgery with its antecedent and post side effects when you know very clearly that you can give these results even without surgery? So all in all, I mean, it's important to understand that fillers are a good thing to have. You should know when to use surgery. You should know when to use fillers. You should be able to titrate, because ultimately, as we become better at our work, our job is to make sure our patients are happy. Now, you can also use fillers in other creative ways. This is a broad nose. You can see how it looks before surgery. And that's post-rhinoplasty surgery. And after the rhinoplasty surgery, she thought the nose became too small. We've used a little bit of filler post the rhinoplasty surgery to sort of change the way the line looks, how the reflection occurs. Ultimately, fillers is like permanent makeup, and you can use it for a touch-up as well. And look at some of these results, right? I mean, just look at this particular lady. I'm sure I would have been proud of this as a surgical result, but this is a completely non-surgical result. And you can see how her dependent tip, how her beak-shaped nose has been converted to a far more elegant-looking nose non-surgically. So as we go ahead and move forwards, it's important to publish papers which moves aesthetics forwards. In our opinion, every patient we see is contributing to the way people are being treated in the future, and therefore we need to move science forwards. This is India's first paper on using Althera. These are two different types of botulinum toxins, which is comparison of Botox and Xeomin in a split head trial. This is the use of deoxycholic acid, also called Kybella, for the first time in India. This is a paper which talks about how taking selfies does it lead to an increased desire to undergo cosmetic surgery. This is a new mechanism of using botulinum toxin for facial scar improvement, a new indication for which Allergan now is applying for an on-label license. This is the use of Althera again. This is the importance of the eyelid crease whenever we go ahead and utilize or do a ptosis surgery. This is our own invention, the QR678, which is a US patent and Indian patent, and is now FDA approved in multiple countries and is being exported to 10+ countries. So all in all, moving science forwards is what we do. Hair injections, whether that's growth with regards to hair, whether that's any of our non-surgical treatments, whether that's use of any of our surgical treatments and transforming faces in that particular manner, whether it's orthognathic surgery, whether it's any type of surgery that you may think about. Ultimately, we also love teaching. I think it's the love of teaching which has got 4 of us on this dais to try and teach you. And these are courses that we conduct very regularly. As some of you may be aware, Our fellowship in facial plastic surgery and facial cosmetic surgery is now recognized by 2 universities in Maharashtra. And by that entire thing, people who get trained in facial plastic surgery and facial cosmetic surgery with our groups can now go ahead and get MCI recognition in the same. The fellowship in facial aesthetics becomes very important for us as well to make. We just completed our umpteenth batch on the 22nd of August 2021. We will be completing our umpteenth batch. We just completed a batch in June. As we move forward, let's try and transform science. Let's try and move our knowledge and others' knowledge forwards and continue to learn from each other and hopefully transform the way the world looks today and will look in the future. I thank you all for your kind attention and a patient hearing. We'll open the floor up for any questions that exist at this moment in time. And thank you once again for your love. Dr. Kasturi, Dr. Preeti, Dr. Shilpa, and I are immensely privileged to be helping you learn and further your practices. Thank you.